Universal screening can be defined as administering measures and/or collecting other data to allow broad generalizations to be made regarding the future performance and outcomes of all students at individual and group level. In other words, classroom, grade, school, and district. As a screening, it's meant to give district and school teams a broad view of the overall health of instruction for all students. It's important to note at this point that there's supporting materials within the additional resources folder on this portion of the module. You'll want to refer to these as we go through universal screening. The universal screening for academic skills in kindergarten through about 8th grade is generally conducted 3 times a year, fall, winter, and spring. These are most often conducted using curriculum-based measures or computer adaptive testing. Although the measures and skills assessed will change between grade levels and across content areas, the design features will remain the same. It's administered to all students. It should identify students who are at risk of future academic, behavioral, and emotional difficulties. It should provide you data regarding how well your current instruction is meeting the needs of your students. It should provide information to educators about individual student and system needs, and measure critical academic areas. It should be standardized and have a quick administration time and be technically adequate or reliable and valid. And it should be predictive of larger outcomes. In addition to traditional academic skills screenings, within MTSS, we advocate for behavior and social emotional screening, attendance screening, and also looking at historical data in a strategic way. Schools should be compiling their behavior data, at least in the form of office discipline referrals, in order to first assess the health of their universal behavior supports, and 2, identify students that may need more intensive support. Student discipline data is a good first step in the universal screening for behavior. However, this examination of data alone will not reliably identify students that may require interventions for behavior. It will most likely only identify students with outward behavior problems. Teams may also wish to look at students' compliance with behavioral expectations in your school over time. The North Carolina Department of Public Instruction provides a tool called the Behavioral Assessment Tracking Guide, BATG. The link to this tool is within the supporting materials that accompany this module. Attendance data should also be collected and analyzed alongside academic and behavior data. Research tells us that a good threshold, or data decision rule, for attendance is to intervene for students or groups of students if they have been absent for more than 10% of school days or lost more than about 10% of instructional time. Ideally, school teams should examine this data monthly. Most schools, by about 6th or 7th grade, may consider discontinuing screening all students for discrete academic skills, as is done in elementary school. By this time, schools can begin using historical data and other indicators to fulfill the purposes of a universal screening. Remember, we are primarily attempting to fulfill the purpose of determining who is at risk. We can often, not always, answer this question through historical data as students get older. The term employed for this type of screening is often an early warning system. We compile factors we know from research place students at risk for poor outcomes in order to put systemic and individual interventions in place. Including in the supporting materials is information about these indicators that can be used to screen students in a secondary setting. The first piece of information that a universal screening can give us is a general indication of the health of our core instruction. In elementary school, when we assess students' knowledge of and fluency with basic academic skills, at least 3 times per year, we're able to determine if our students are gaining the foundational skills at a rate that research tells us will allow them to meet any standard. If we have large numbers of students not growing with these skills, or coming in with gaps between where they are and where research tells us they should be, we have a strong indicator that we may need to intensify our core instruction to close that gap as soon as possible. Behaviorally, screening these skills will tell us if our universal layer of behavior support is strong enough for the students we serve. In the secondary setting, we also look at the research-based markers found in the early warning system literature to determine if our core instruction is robust enough to meet our students' needs. Universal screening, especially in the younger grades, also allows us information regarding where skill breakdowns may be occurring for all students. Many times we know that large numbers of students are not meeting standards from our summative assessments, but these don't give us information regarding skills needed to meet these standards. Universal screening will also tell us where the strengths lie in all of our students so that we can devote precious resources to the appropriate instruction. An effective universal screening should be linked to a level of prediction with success on larger outcomes. In other words, the data gathered in a universal screening should give us just-in-time information regarding student skills that correlate with larger outcomes. By having this information early, we can change the path of student progress by changing the course of our instruction. Finally, a universal screening allows us early warning of students or groups of students at risk of poor outcomes. Research tells us how students should be performing and progressing academically and behaviorally at each grade level to stay on the path towards graduation and college and career readiness. Universal screening data can tell us early if students are off track in order that we can change course and change the outcomes predicted. Visit the supporting materials included in this section for more information regarding universal screening, critical areas to screen, and websites to explore in order to find tools to use for this purpose.